This is a background for an assignment to learn a formula called the CRI. That's Calculated Reticulocyte Index. Why bother? Well, when you're looking at a patient with anemia, if you figure out the CRI, it'll give you clues. One of the clues will be, is this acute or subacute anemia? And by acute or subacute, I'm referring to whether it's present for hours, days, or weeks. The other clue is if it's chronic, and by chronic I mean weeks to months. Another important clue is that the CRI will tell you if there's actually a physical loss of blood, such as hemorrhage, externally or internally, or if one of the reasons for anemia is hypoproliferation of the bone marrow. You can have hypoproliferation for many reasons, but one example would be if there's a cancer, physically crowding out the erythroblast, the mother of all red blood cells. Another conclusion or inference you can make is when there's impaired maturity of the erythroblast. That leads to an impairment of the developing red blood cells. What is the reticulocyte count? Well, the reticulocyte is actually a juvenile form of the adult red blood cell, sort of a juvenile delinquent. There's a certain percentage of reticulocytes present in our normal circulation, but in certain circumstances the reticulocyte count will change. Imagine for a moment you've just found someone on Facebook you haven't seen for many years. You set up a meeting and you discover that they're a vampire and they proceed to drain you of a couple pints. Now, assuming that you're in robust health, all your vitamins are up to date, your bone marrow will have a robust response to this challenge of anemia, and you'll start cranking out lots of red blood cells, a greater percentage of which are juvenile forms called reticulocytes. So the normal response to anemia is to crank out more and more juvenile delinquents, and you'll see an increased percentage of reticulocytes. Now, the formula has two parts to it. The calculated reticulocyte index has part A, part B. The first part is you figure out what the reticulocyte count is, and you simply order that. When you order CBC, you put down with reticulocyte count, and you'll get a number. Now, to figure out the reticulocyte count index, it's going to be the reticulocyte count on the CBC that you've ordered over the patient's hematocrit, times the patient's hematocrit over an idealized hematocrit, which is 45. So let me go through that again. You get the patient's reticulocyte count times the patient's hematocrit over an idealized hematocrit, which for the purposes of the formula will always be 45. Now, the second part of the equation is the corrected reticulocyte count. And the first part of that is simply the calculation you just did, reticulocyte index over a fudge factor. If you look on your handout, you'll see the fudge factor table. For any particular hematocrit, there is a fudge factor of 1.0 or 1.5. Again, there is a range of values for a hematocrit correlated with a certain number, and that number is the fudge factor. So what are the units being measured? Angstrom units? Miles? Kilograms? Well, the units are actually days. In a person who has a normal bone marrow, no anemia, the reticulocyte itself lives for about 1 day. When, however, there is an anemic challenge, the younger versions of the reticulocyte live longer in the bloodstream. And so if the hematocrit drops, the younger hematocrit, or I should say the younger reticulocytes actually can live longer, and so for a particular hematocrit range, they may live for 1.5 days, or they may live for 2.0 days. So that's the fudge factor. It's actually days. And when you get that fudge factor added in, then you get the corrected reticulocyte count. Now, I'll explain to you in class more about the specific numbers, but you'll get a final number. And generally, if that number is less than 2.5, it means there's a decreased production of red blood cells causing anemia. That could be multifactorial. It could be hypoproliferation versus a maturation defect. Could even be chronic inflammation causing suppression of the bone marrow. If the number is above 2.5, it usually implies there's a physical loss of red blood cells. Externally, motorcycle accident, hemorrhage. Internally, motorcycle accident, bleeding internally. sneaky cause for loss is hemolytic anemia. You don't normally think of that as red blood cell loss, but that is. We'll discuss examples of this in class. So learn the formula, live it and love it. I expect you to be able to use this formula without thinking about it. You'll have it plugged into your brain, plug in the numbers, and during the class we'll be doing participatory problem solving, and I'll be calling on you to figure out the reticulocyte index and the corrected reticulocyte index to make conclusions about what you're going to do, how you're going to approach the patient with anemia, and what tests and what therapy you're going to order. So learn this formula. And right now I can sense that here in the studios over at Rancho Laxo there is an impending seismic event coming on, so hold on.